Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below.
I had herniated cervical discs, and I have had a 2-level disc removal and spinal fusion at C4-5 and 5-6. But I've had quite a loss of range of motion, especially tilting to the right and to the left. I have less range of motion looking all the way to the left or right. More limitation looking.
Looking to the right.
Yeah, and looking up. I can't hardly look up at all.
When did you have the surgery?
1994.
94. And since then, you've been having those limitations or get worse over time?
I had limitation from then, or probably before the surgery. It may be getting a little bit worse. I have, on the more recent MRIs, other bulging discs.
Above and below, that's typical. Have you had any treatment for your neck? What did you do for your neck?
So I ended up having a minimally invasive spinal decompression on the next level down. 6-7.
What about physical therapy or anything?
Just post-op physical therapy.
Post-op. And did you notice your range of motion improved, or was it just subtle?
Actually, all the physical therapy I've had has never increased my range of motion. It would make my muscles
lose less spasm. Our goal is to get you range of motion. Let me see your range of motion again. Rotate left and right. That's tight here. Not too bad this way. Extension, flexion. That's really tight. Side bend left and right. How much pain do you feel?
It just feels like it's stretched to the limit rather than that pain.
Pain, just something
I mean,
blocked.
it starts to feel uncomfortable.
But it's all tightness.
Yeah.
And where do you feel the worst area of tightness?
I would say looking to my right and looking up.
And where do you feel it in the back?
Yeah, right back there. I feel it more on the right side. And then when I do this, it's just whatever.
Which level do you have it fused? Left, what?
C4, 5, 5, 6.
4, 5,
6. So
5,
probably C4 through 6 is now one solid bar.
One solid bar. Okay. All right. So let's line your back head here.
On my back.
And relax. Let me know if you feel any discomfort. You feel all this tightness here?
Yeah, it feels like it's tight when you're pressing.
And make sure it's pain-free. You get a lot of time. Relax. Have you had any head trauma?
None to speak of. No significant trauma.
Nothing. Make sure it's not painful.
That isn't at all.
So we're gonna do the same thing, just gonna do few relief, and we'll check your range of motion, and after that, do the release and testing and see how far we can go. Okay, with that. Okay, that's beautiful. Okay, I maybe do, if you're comfortable, a deep release. Okay.
Because it does feel tight on the lower cervical.
All right. So after the first treatment, let's see how you feel. How's your range
Feels
of
more. Now I'm looking at that picture.
That's a full range of
Yeah.
motion on that side.
Oh yeah, this one I can now see back to that door.
That's awesome.
So that's gone. Okay.
That's because the fusion. Let's look. How's that
It's better than before.
compared to the first time?
This one is still more limited.
What about flexion forward?
This one I never felt I had a real problem.
This is okay. So you're getting more on the
Oh,
left and
definitely
right, definitely
more.
on that side. Thank you so much. Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below.